depolarization. Okay, ventricular depolarization. Okay, in which the ventricles contract. Now, what's our normal time duration for this QRS complex to happen? Okay, take note that in order for a QRS complex to happen, it must be within not more than 0.12 seconds. Okay, your QRS must happen not more than 0.12 seconds. So that's around three small boxes on an ECG strip. Okay. As you could see here on our picture, okay, it looks like sharp, tall, spike with Q dip. R represents the pick, and another S for a dip. Okay, so Q dip, R R pick or R spike, and S dip. Okay, normal duration for our QRS complex to happen is not more than 0.12 seconds. I repeat, not more than 0.12 seconds. That's around three small boxes in ECG strips. Okay, now let's go to your ST segment. Okay, your ST segment. ST segment. Okay, from the end of your QRS, so it's around here. From the end of the QRS to the start of the T wave. Okay, as you can see, there's a bump here on your T wave. Okay, from here S to the bump of your T wave, this is when ventricles are depolarized before they repolarize. Okay, I repeat, starting from the end of your QRS complex up to the bump of your T wave, what happens here is your ventricles are depolarized before they repolarize. Okay, so normally it's flat. Okay, and we have a duration period of 0.08 to 0.12 seconds. Okay, your ST segment, which happens from the end of your QRS complex up to the bump of your T wave, that is around 0.08 to 0.12 seconds. Okay, now let's go to your T wave. Let's focus to the bump of your T wave here. T wave. Your T wave represents ventricular repolarization. I repeat, when we say repolarization, your ventricles relax. That's why, as you can see here, it's kind of flat. It's because it's the repolarization period. Okay, it relaxes, so it shows flat line, isoelectric in some terms. Okay, it is normally flat, and sometimes U wave tends to appear after your T wave. Okay, now let's talk about the normal duration of your T wave. Well, there is an exemption to the rule when it comes to your T wave. Okay, when it comes to your T wave, duration is not strictly measured. Okay, when it comes to your T wave, but it is usually wider and longer than your P wave. Okay, your P wave here. So it's around 0.16 seconds, 0.16 seconds. Okay, T wave, this one. Okay, that's around 0.16 seconds before the isoelectric area here, which happens for your repolarization. Okay, so now let's go to your QT interval. Okay, where can we find our Q and T interval? Okay, for your QT interval, okay, time from the start of the QRS, okay, the QRS to the end of the T wave, okay, that represents your ventricular depolarization and repolarization. Okay, the normal duration for this one is 0.36 to 0.44. 0.36 to 0.44 seconds. Well, that's the standard, that's the ideal, but it could varies with heart rate. Okay, so please don't forget your PQRST and U wave. Okay, be mindful of our normal duration period so we could easily figure out if a certain ECG reading is out of normal. Okay, now as you could see on your screen, that's a normal ECG reading. Okay, let's have a quick recap. For your P wave, atria contract, of course, that's around 0.1 second. Okay. For your PR, atria going to your ventricles, that's around less than 0.20 seconds. Okay. And your QRS, okay, in which your ventricles contract, that's around less than, not more than, it's less than 0.12 seconds. And for your T wave, ventricles recover, in which your ventricles recover, that's around 0.16 seconds. Okay? Be mindful that a normal EKG shows steady, as you can see, steady, regular heartbeat, okay, with all the waves, as we mentioned a while back, and intervals appearing in the right order, okay, your P, PR, QR, ST, and sometimes U, intervals appearing in the right order, shape, and timing. Okay, please don't forget our normal duration so we could figure out if an ECG is out of normal. Okay, some arrhythmias are so brief, okay, like a temporary pause or premature beat, for an instance, that they don't significantly affect the overall all heart rate or rhythm. Okay, but however, when arrhythmia lasts longer, I repeat, when arrhythmias last longer, they can make the heart beat too slowly, too quickly, or in an irregular pattern. And when this thing happens, this disrupts the heart's ability to pump blood effectively. Anything that goes fast, anything that goes slow is not good for the normal functioning of our heart. Okay? Now, let's have your bradycardia. Okay? We are aware that the normal beats of our heart is around 60 to 100 times per minute. So we could somehow safely say that when we are referring to your bradycardia, it's somewhat slower than your 60 to 100 times per minute. Okay? Bradycardia can be serious if the heart beats so slowly that it can pump enough oxygen, rich blood to the body. Okay. When this happens, a person may feel dizzy, very tired, or even weak, short of breath, or even faint. Okay. However, bradycardia doesn't always cause symptoms or lead to complication. In fact, a slow heart rate isn't always a cause for concern. Okay? For example, a resting heart rate between 40 to 60 beats per minute can be normal during sleep, and that's okay. Or in healthy young adults and trained athletes. Okay? If bradycardia becomes severe, worst case worse happen. An implanted pacemaker may be needed to help maintain an appropriate heart rate. Okay. Now, let's have some of the symptoms to watch out for when we are dealing with bradycardia. Okay. A slow heartbeat may prevent the brain and other organs from getting enough oxygen, which can lead to, of course, chest pain. Okay. Because there is an enough amount of oxygen rich blood supply to the muscle, which causes chest pain. Okay. Not enough oxygen that goes to the brain, which leads to confusion or memory problems. Dizziness or lightheadedness is also included in the list. Fatigue or feeling easily tired during activity, fainting or near fainting, okay, and even shortness of breath. Okay. When we are dealing with your bradycardia on an ECG strip, bradycardia simply means the heart rate is, of course, slower than the normal, which is your 60 beats per minute. The rhythm is usually irregular. Okay, it's almost the same as the normal one, but the T wave, okay, the T wave, the T wave here also look normal and appear in the right sequence. But where does the problem appears? The key clue in your bradycardia is the distance of your QRS. QRS, okay, are much wider. As you can see here, our QRS here in the normal heartbeat is a bit tighter compared to your bradycardia, are much wider, longer than normal, which shows fewer beats in the same amount of time. Okay, so in short, when we are trying to figure out if a certain ECG strip is bradycardia, the only thing that you have to figure out is the distance of your QRS complex. In bradycardia, it's narrow. Okay,